Okay, so today we're going to discuss about the tumor immunology. Okay, so basically, this topic will be discussing about the production of your tumors. So the tumor immunology, when we speak about the tumor, so this is the topic here wherein it speaks about the production of the mass of cell or tissues rather than an inflammatory reactions or inflammatory response compared with other diseases that we have discussed already. Okay, so this topic will be discussing about here the different tumor antigens that's being associated with each of your tumors that will help us then to identify the tumor. So we'll be discussing here about the tumor markers. Okay, then we have here, we're going to discuss as well here the immune system, the effect of the cancer or the tumor here with our immune system of the host or the infected patient. And we'll be discussing as well here about how the immune system works in order to eliminate the tumor in our body. Okay, then we have here the nomenclature of your cancer. So this is actually the act of or the process of giving names to your cancer. So the name of the cancer would be highly dependent on number one, on what tissue or cell here has been involved on that. So they are named here according to what is involved or what is affected in the tissue. Second one, some of the tumors being named here because of the one of the person or the scientist who tried to discover that one. And lastly, some of your tumors has been named because of their certain morphology under the microscope. So the changes of the cells that happens or has just to be affected because of the production of your tumors. Okay, before we go to your the etiology of the cancer production, so we have here your stem cells. So when speak about the stem cells, so basically this is the cells here that would have here the following properties. Number one is capable self-renewal. Okay, so basically the stem cell here, the normal process of the proliferation development of your stem cells, it try to produce here daughter cells which try to resemble the morphology of the parent cells. It should exactly the same as the parent cells. Another one, your stem cells here would have here the capability to develop into the different cell types or multi-lineage. And we have also here the third one, we have here potential also to proliferate and try to develop your different cells. Okay, this is the normal capacity of your stem cells, but you develop here a cancer if there will be problem with the development of this one. By the process of your mutation, so eventually your stem cells try to undergo some abnormality as to its development, as to its production, differentiation, and that's where your tumor try to produce. Okay, we have here the classification of your tumor. So we classify that one as your benign or even your malignant. So for the benign, you were able to know here that the tumor is benign because of its name. Most likely for the benign, its suffix, you try to end in the word oma, except the following lymphoma, melanoma, and we have also here the hepatoma, which are considered to be malignant tumors. Okay, we have here the characteristics of your benign tumors. This one is encapsulated. So when speak about encapsulated, nasa encapsule, hindi siya parang buko lang siya in one particular area. It's cystic in nature. The second one is grow slowly. We have less mitotic activity. We have also here, resemble here the parent cells, most likely. Would have not yet going far from what is a parent cell. Okay, so example of your benign tumor, we have here your adenoma, which is your benign tumor here involving your adrenal glands, or glandular epithelial tissues, I mean. We have also the papilloma for the polyps. And we have also here the non-neoplastic lesion, characterized here by the overgrowth of your normal cells only in the form of your hyperplasia. So that's just increasing the number of the normal cells. So they consider here as the normal or benign type, that's your hyperplasia. The fourth one could also be because of the normal tissue found here in the foreign location. So like for example, pancreatic tissue found here in the stomach area, but still considered still as a normal. On the other hand, we have also here your malignant tumors. So the malignant tumors would have the following characteristics. So number one, this one is I try to increase in the number of the cells we try to proliferate different part of your body. Has the tendency as well here to invade other tissues. You try to disseminate by passing through your lymphatic vessels or even your blood that go to your lymph nodes and try to metastasize to other part of your body. Another one, it try to have your characteristic nuclear cellular feature. And number six, try to possess your receptor for your integrin molecule. Integrin molecule here serve as the binding site that allows your malignant cells to adhere to your type 4 collagen, which try to destroy your extracellular matrix of your collagen. The seventh one we have here, try to secrete your tumor necrosis factor alpha and tumor necrosis factor beta, which try to promote your angiogenesis or your new blood cell production. Another number 8 here is the most important feature for you to classify that one is malignant if try to recur. So pabalik-balik, like even if the patient has undergone already a treatment like irradiation, chemotherapy, or even surgical excision, tinanggal mo na ang breast, for example, pero bumabalik may bukol ulit. So that might be a malignant issue. Okay, we have here example of your malignant tumors. So first, we have here involving your epithelial cells here. So you could have your squamous found here in your lungs and esophagus. And also transitional epithelial tissues involving here your urinary bladder. You could also have here the glandular epithelium. We call this one adenocarcinoma, which involves your stomach, your colon, your pancreas. Another malignant tumor here, you're involving your amine precursor, the carboxylation tumors. Example for that, we have your neuroendocrine arising here from the neural crest or the neural ectoderm. So we are talking about your small cell lung carcinoma. So we have also here your sarcoma from your connective tissues and teratoma here from your germ layers, meso, endo, and ectoderm. So involve here mga or sex cells producing organs in our body, like for example your testes and your ovaries. Okay, we have also here the summary of that. So we have your malignant here. So carcinoma. Okay, if involve your epithelial tissues. So if involve your glandular epithelial tissues, so you call this one adenocarcinoma. Squamous cell carcinoma, if it involve your squamous cell. So sarcomas are involving here your connective tissues. This one is your bones, that's your osteosarcoma. If it involve your cartilage, it's your chondrosarcoma. For hematologic, mga try to originate in our blood cells. So it involves here your lymphoid, so that's your lymphoma. It involves your myeloid cells here, so there's myeloma. Okay, now we have here your cancer stem cells. So basically, when speak about the cancer stem cells here, so these are the stem cells which has the capacity to develop here to become your cancer. Number one, so this is a tumor initiating cell derived from your hematopoietic system, like even your breast or even your lungs. Second one, we have here, since being a stem cells, we have here the capacity to differentiate, proliferate, and would also have your capacity to drive continued expansion of, proliferation of your malignant cells. So basically, if this one, it become cancer cells here, if this one eventually is acted upon here or once are exposed with your carcinogens. Okay, now we go to the epidemiology of your cancer. So we have here the prevalence. So we have here the leading cause of death related to your cancer. Number one, we have here the lungs, followed here by your colorectal cancer or your colon cancer, followed by your breast. Okay, then we have here, as of today, we have here the increasing incidence of your cancers. So until now, it still become here prevalent in terms of the problem with this type of cancer. Number one, we have here the lungs. We have also your breast. We have also here the pancreas, cancer of the prostate, multiple myeloma, and we have also your Hodgkin lymphoma. As of today, we have here the decreasing incidence because of the development here with the treatment like your vaccine. So we have your cancer of the stomach, cervix, and we have also here the endometrium. Okay, for the prevalence for adult population, for the male patients, so the leading cause of cancer here, or the leading number of cases of the cancer here would be your prostate, followed here by the lungs, and followed here by the colon cancer. For the females, so breast cancer still be the leading cause of death. We have also here the lungs, and we have also here the colon cancer. For the children, so cancer for the children here is considered as actually as the second leading cause of death among children. So number one associated with the cancer of the children would be the acute lymphocytic leukemia, followed here by the tumors of your central and sympathetic nervous system. Next one, we have your malignant lymphoma. The fourth one, we have your soft tissue sarcoma. And we have also here the renal tumors. Okay, then we have your different risk factors for the development of your cancer tumor. The first one, we have your smoking. Smoking would be the leading cause here of the lung cancer. Then we have your high fat, low fiber diet for the colon cancer, sedentary obesity, we have also here sedentary lifestyles and even race would have genetic factors related here in such a way that has been identified that almost 20% higher incidence in the black population American compared to the white populations. Okay, then we have also here the risk factor for development of the breast cancers. The first one, we have here the family history of the breast cancer, any form of cancer within the family, especially for the first degree relatives. Second one, we have here the pregnancy, which is already late. Okay, the first pregnancy here, more than 30 years old. Third one, we have here the presence of your fibrocystic disease. The fourth one, we have the use of your oral contraceptives or your oral replacement therapy, like for example, your estrogen therapy. And number five, we have the prior exposure to radiation with your chest or even your breast wall radiation. And it would eventually have the tendency to develop here the cancer because you've been exposed to radiation. Okay, now we have here also some of the environmental factors and the associated disease association with the tumor. So we divide this one into we have your aerosol and industrial chemicals or pollutants. Example for that, we have your asbestos related here to your development of your mesothelioma. Exposure to your lead, to your copper, zinc, arsenic, also here to your lung cancer. Vinyl chloride would have here predisposed someone to develop here your liver carcinoma. Benzene for the leukemia, aniline dyes for your skin and the bladder carcinoma. For your drugs, we have your corticosteroids result here to your liver hepatoma. We have also your stilbestrol related here to vaginal carcinoma. We have also here your estrogen therapy for your endometrial cancer. Identifying for the lymphoma and chloramphenicol alkylating agents as well related to your leukemia and your lymphoma. For some infectious agents, we have here your Epstein-Barr virus related to your Burkitt lymphoma, nasopharyngeal carcinoma, human papilloma virus, and we have your herpes virus related to your cervical cancer, HIV, your human T-cell lymphotrophic virus 3 associated with your Kaposi sarcoma, and then your non-Hodgkin lymphoma. Human T-cell lymphotrophic virus 1 related to your non-Hodgkin lymphoma, and we have your hepatitis B related to your liver hepatoma. Most likely, exposure also here to your sunlight would eventually result here to development of so-called here your thymine dimer. Okay, your thymine dimer because of development or because of exposure to your UV radiation. And thymine dimer here is just dalawang thymine. So usually in the base pairing, we have your adenine with your thymine, GC. Okay, ganyan. So most likely, puro lahat dalawang thymine. Okay, dimer. So eventually, because there's some mutation because exposure to your sunlight, the UV light, and eventually so here to your skin cancer. Okay, another one, we have also here the disease association. So some of cancers are also associated with different diseases. So example for that, we have here your Down syndrome would predispose someone to develop here leukemia. We have also here your Paget's disease for the bone disease, osteogenic carcinoma, sarcoma, cryptorchidism will related to your testicular cancer, neurofibromatosis related to your brain tumor, cirrhosis with the liver, choroidea, pernicious anemia, PAs or pernicious anemia that would be related to your gastric cancer. Cholelithiasis would be your gallbladder. Chronic inflammatory bowel syndrome related to your colon cancer. Then we have also your myasthenia gravis and pure T-cell aplasia with your thymoma or your thymus. That would be defective thymus production. Okay, now we have here the stages of your oncogenesis here. So we start with the initiation. So initiation is just here the irreversible mutation of your proto-oncogenes, or this is your precancerous gene. Second one, we have the promotion, which involve here the growth enhancement, primarily wherein the mutation is being passed from one cell to another. Third one, we have here the progression, characterized by the development of your tumor to becoming more heterogeneous. So pag more heterogeneous siya, the more it is not recognized by our immune system, and therefore it's more unresponsive to the treatment, like for example your chemotherapy and all the treatment. Okay, now we have here the progression of your cancer. So progression here from precancerous to become cancerous genes. So example for that, we have your, especially if it will try to progress to become an invasive cancer once it's not detected and the patient do not undergo treatment. So example for that, we have the cervical carcinoma. The progression transition here from your squamous cell metaplasia, it become dysplasia, carcinoma in situ, and eventually try to spread and eventually become here the invasive. Endometrial carcinoma, on the other hand, starts here with your hypoplasia, then magiging atypical endometrial hyperplasia, then carcinoma in situ, and we have also here eventually invasive carcinoma. Okay, so try to progress here to become invasive because of mutation or the overexpression of the oncogenes responsible here for the growth and proliferation of our cancer cells. Plus, there's also the suppression of your tumor suppressor genes. So these are the genes that helps our body in order for you to fight your cancers. Since you suppress your protective mechanism here, then eventually tumor will just proliferate. Example of your tumor suppressor genes, we have your P53 and we have also the RB gene.